Hello, I'm Dr. David McFadden from the Dental Implant Center in Dallas, Texas. Today's topic is going to be the speed at which we perform dental implant reconstructive treatment. And it's interesting that on my way over here today, I saw 3 billboards advertising for dental implant practices who will give you teeth in a day. Teeth in a day, teeth in a day. Won't be long before we can give you teeth yesterday. But in all seriousness, that topic of teeth in a day is an important one that patients don't completely understand. So we live in this society of immediate gratification where we press a button and we see a movie on demand. We place an Amazon order and we get it the same day. We drive through fast food and we can eat our meal within minutes. So I understand the idea of people wanting speed, wanting immediate gratification, wanting teeth in a day. But what if I told you that during every implant surgery, especially the big ones, what if I told you that the doctor that places your implants at some point during that procedure has to choose between speed and quality? Nobody ever talks about that. But that temporary that you're going to get on the day of surgery, many times we're making that really, really important decision, speed or quality. So let me explain a little bit further. To give you immediate fixed temporaries on your implants the day of surgery, you have to have good bone volume and good bone density. We can measure bone volume on the x-rays. So going into the surgery, we know how much bone you have. What I don't know, and what nobody ever knows going into the surgery, because there's no test for it, is your specific bone density. No 2 patients are alike. So we can't promise people teeth in a day. How do we come to that decision? So first let me clarify that you're never going to leave this practice without teeth. So don't worry about that. You're going to leave here with a beautiful smile no matter what type of temporary you get. We'll be prepared for both. You'll have the entire day will be scheduled for you and you alone, and we will be prepared for all scenarios. But when it comes to the teeth in a day that you see on the billboards or the commercials or that you hear about on TV, that teeth in a day is what I want to address when it comes to bone density. So the way we do it here in this practice is we leave our options open. I'll take out strategic teeth, I'll place the first 2 implants, and I'll measure the implant stability, which is a reflection of the bone density. If the first 2 implants are stable and your bone density is good, then we will continue on with the treatment. I'll place the rest of the implants and you'll get a fixed temporary on your implants that day. If either one of those first 2 implants has low stability or poor bone density, we will not give you that fixed temporary on the implants that day. What we can do is leave other teeth in, take some other teeth out. We'll be strategic about how we plan the rest of the surgery so that you'll leave here with the temporary that we've talked about at your initial treatment planning visit. That temporary that's delivered on the day of your first surgery can make or break the outcome of the treatment. So I'll reiterate that many times in these treatments we're choosing between speed and quality. And I hope you're like me. I hope that you'll always choose quality over speed. So if that means you have to go up to 8 weeks with a different kind of temporary, then by all means that's what we should do. So I will always tell patients going into the surgery, I will make that decision for you if you're sedated. If you're not sedated, we can talk about it. But my goal is to always choose quality over speed. I hope you agree. I hope this information has piqued your interest, but I've only touched on the surface of this whole idea of speed versus quality as it relates to your temporary on the day of surgery. If you'll click on the link below, it'll take you to a narrated PowerPoint presentation where I go in much more detail about this topic. Thank you for listening.